I have found at first I was very cautious in things Bernard said. You know, I didn't want to say something as if the child would take it realistically. But as I've worked with him throughout the years, I've learned that the more Bernard exaggerates a procedure, the more the child loves it because it brings it down to reality on their part. And then somehow the child will pick up on correcting Bernard, and they love to mock that parroting role toward Bernard.
Here, I got a blood test today, and the needle, David, that needle was 10 feet long. It was this big. It was this big. It's this big. Wasn't it right? Okay, it was this big.
Once a week, Bernard and Diana gather children who are scheduled for operations and help them learn what surgery is all about.
You know, what I like to do when I teach Bernard about surgery is to play. That's one of my most favorite things to do is to play with Bernard.
Did you see my wild thing, Gary?
Bernard, would you pay attention?
Oh, excuse me.
Well, anyway, we're going to play doctor, and so I'm going to let Bernard and you be the doctors. Listen, we need somebody to be the patient. Who do you think would make an outstanding patient tonight?
Not me.
Bernard. Everybody who thinks Bernard would make the perfect patient, raise your hand.
No.
A very important thing that I do is in the pre-op teaching, in which the children that are scheduled for surgery have opportunity to dress up like doctors and take Bernard down to the real holding room where they hold him, in the real surgery room where they put him to sleep, and the real operating room where they'll operate on him, and the real recovery room where they'll wake him up. And this way they learn, and they never know they're learning. They have so much fun. Okay, doctors, you're doing great. Now this is the real surgery, the very real surgery room that we're going in. We're just playing tonight, but this is the real surgery room. We need to pick up our patient and put him on the real surgery bed, okay? Ready?
Don't drop me.
Like that. And the thing.
How about me? Well, I'm glad you didn't leave me in my hour of need.
Bernard, would you please breathe? Here you go, doctor.
Here's small blood vessels.
Here's small blood vessels. All
There's
right.
a lot of blood vessels in here. That's all he has.
Terry Chapman is a nurse in the children's ward and has come to appreciate Bernard's presence.
He's a friend to them more than anything. And children will talk to Bernard when they won't talk to Mama or Daddy or the nurses. They will tell him everything. So it's just special. We can find out a lot of things about what children are feeling and where they're at so that we can help them better.
Do you know what happened to one little Bowie? See, he was really afraid of surgery, because in surgery sometimes it's scary. And well, he had a granddaddy that had died about 2 years ago with a hernia operation. And then 2 years later, here came this little Bowie, and he had to have a hernia operation. And his mommy and his daddy didn't think he remembered that his granddaddy had died, because he never talked about it or nothing. But guess what? When we were playing, when we went to the wake-up room, they're trying to wake me up. And I didn't wake up right away, and guess what he did? He got all upset, and he started crying and hollering, and he grabbed me by the throat, he did, and he was shaking me, and I was going, oh, and he was saying, "You died, Bernard, you're not going to wake up, you've died, you've died, you've died, you've gone to heaven." See, that lets us know that little boy really was scared. And if we hadn't have played, we'd have never known he was scared. And he'd have been put right to sleep thinking he was going to die. That'd have been horrible.
this isn't a puppet show. It isn't a time for a puppet show. It's a time for love to take place, and a time for comfort to take place. And fun and play can enter into that. But it takes a very, very special heart and a very special understanding to walk into a room full of that kind of grief and bring comfort and bring a smile. Like I said before, that power isn't Bonheur. It comes straight through my arm to a heart that belongs to God.